Evidence is mainly taken from mixed stroke TIA trials, and the optimal monitoring strategy for TIA patients to detect atrial fibrillation is unclear at the moment. The purpose of this systematic review was to determine the rate of newly diagnosed atrial fibrillation greater than 30 seconds in TIA patients using different continuous cardiac monitoring durations and modalities. Results of our systematic review and meta-analysis are that we included 42 studies with 50 monitoring cohorts, including 3,981 TIA patients. And there are 4 key results. First, the pooled AF detection rate in TIA patients is 6.5%. Second, the AF detection rate increases with monitoring duration. For example, at 30 days, the AF detection rate is around 9.6%. And at 1 year or 12 months, the AF detection rate is at 19.1%. Third result, implantable cardiac monitors detect more atrial fibrillation after TIA compared to non-invasive monitoring, namely 20.8% versus 4.7%. And fourth, in exploratory analysis of ischemic event rates, we found an event rate of 4.9 per 100 patient years during follow-up. Strengths of our systematic review include that this is the largest TIA-specific systematic review for AF detection, including 435 TIA patients with invasive monitoring. And limitations include that this is only an aggregate data meta-analysis and not adjusted for individual level confounders. And overall, in the studies included, there's high heterogeneity in definitions of TIA, in definitions of atrial fibrillation, monitoring method and monitoring duration, and also follow-up. To conclude, this meta-analysis found high rates of newly detected AF using prolonged cardiac monitoring in TIA patients. Studies using implantable cardiac monitoring, specifically in TIA patients, are still rare, and randomized controlled trials are needed for head-to-head comparison of different monitoring strategies, durations, and to determine whether prolonged cardiac monitoring improves clinical outcome in TIA patients. And at this point, I'd like to refer to the late-breaking trial session this Friday morning, where the results of the IDEA-TR trial will be presented. Thank you.